public health charity located in London, working globally to tackle the epidemic of chronic diseases, NCDs as globally they're known. So good morning, good afternoon, good evening to people. We had one person pull out a few minutes ago, or a few hours ago, when she realized that it was 2:30 a.m. her time and decided that her interest wasn't that great, she'd watch online. But for those of you who are up and awake, a very warm welcome. C3 works particularly at the main risk factors that are the drivers of chronic disease. So tobacco, what we eat and drink, and the lack of physical activity. And I think for a moment or two, with the rise of the pandemic, I had a feeling of crisis, that it's hard enough to raise the question of prevention, and that the rise and the frightening, scary epidemic would have everybody think even less about preventing chronic illness. And then, perhaps not surprisingly, we found the very same risk factors were significant in morbidity, mortality with COVID-19. So those risk factors that we've been working on for about 10 years remain really important. We have run since our beginning about 10 years ago international seminars. We used to call them international breakfast seminars, and we were famous for our healthy breakfasts and great company that people could meet and talk, as well as listening to people who traveled to London from other countries. Well, now you don't get the breakfast, and the people don't have to travel. So we have a wider group of people that we're able to engage, and perhaps even more important, a wider group of people who are able to join us, time zones permitting. We're very grateful to our sponsors, Cancer Research UK and the Burdett Trust for Nursing. We're looking for a few more to join them. And today we'll listen to two really interesting experts. And please use the chat function to put in questions, ideas, comments, and they will both be delighted to take questions and have a discussion after their initial presentation. We met Bronwyn King last year and were so interested in the important area of the financial support to tobacco. Certainly in this country, and I suspect in many, we tend to think, when we think about tobacco, we think about people quitting or not. And that's so important still. C3 was shocked about a year ago to discover that an area of Scotland where we were working, 46% of pregnant women were smoking when they booked antenatally. And often there's a sense in the UK, and particularly, that tobacco's the risk factor we've dealt with. We've done very well. It's obesity that matters now. And of course, obesity does matter, but tobacco hasn't gone away. And I think we'll hear today that lots of people are making quite sure it doesn't go away easily. It remains an important, probably still the major driving of death and ill health due to chronic disease. So we are really delighted to have Bronwyn and Gail speaking to us today. I realized the issue about investment some years ago. I can't remember how I stumbled across it. But for those of you who know England, I live in the People's Republic of Camden, and I was truly shocked to find that they were significant investors in tobacco companies. And I think Bronwyn will raise with us a greater awareness of where unintentionally we are supporting tobacco companies so often. So Bronwyn founded tobacco-free portfolios. She's at the other end of the world, so she's either had her dinner or about to. But here in this country is a newer member of her team, Gail Hurley, who has a background in UN development finance, because there's, if you like, three parts to the tobacco world. There's the tobacco companies, there's the people who smoke, but often forgotten are the people who grow tobacco and who depend on it for their livelihood. So we will be delighted to take questions afterwards, but first of all, really looking forward to hearing Bronwyn and Gail. So over to you, Bronwyn, if I can.
Thank you so much, Christine, and a warm welcome to everybody all around the world for joining today. It's a great pleasure to be here. And I think if I can hand over to Gail, and we might get those slides up straight away whenever you're ready. Gail's driving here, so we're seeing if we can do this across the continents, and I'm pretty sure we can. See, here we go. If we just move straight on to that first slide. So I'm just going to start by giving you a little bit of background on, I guess, myself and how I have really moved from being a full-time radiation oncologist, which is my job by background, to where I'm up to today with tobacco-free portfolios. And so I was educated in Melbourne, went to Melbourne University, and I planned on having a career as a full-time clinical, or perhaps clinical and research was really the plan for my life. And my very first job after my intern year, I was asked to work for 3 months on the lung cancer ward at the Peter MacCallum Cancer Centre in Melbourne, which is the largest dedicated cancer centre in the Southern Hemisphere. And I was a classic 25-year-old brand new shiny doctor planning to save the world. And I turned up, and every single patient on my ward obviously had lung cancer, which is a very serious disease, as I'm sure this audience is aware. And if you need radiation for lung cancer, it automatically means that it's probably in the more serious side of things. And nearly all of my patients were smokers or ex-smokers, and nearly all of them had started smoking when they were children or teenagers. And despite living in a very fortunate country with fantastic medicine and all sorts of sophisticated radiation techniques, my best efforts and those of my team weren't really enough, and nearly all of my patients died. And I know that obviously everyone in the community knows that tobacco is bad, but it really struck me seeing it right up front, being the person who had to call in people in the middle of the night to come and say goodbye to relatives, sitting there and watching 40-year-olds die, 50-year-olds, 60-year-olds, watching people say their final conversations to their children who were barely teenagers. It really left a very deep impression on me. And I remember just thinking, why isn't everyone talking about tobacco? Why isn't this on the front pages of the newspaper all the time? This is just such a huge problem. It's of an immense scale. It's such an awful way to die. The cure rates are so bad. Why aren't we doing more about this? And I then went on and specialised as a radiation oncologist, and tobacco really lurks in the background of that whole training program, because so many different cancers, more than 18 different cancers, are caused by tobacco. And I mean, it depends on where you are. So I'm sure the UK and Australia are quite similar in it's about 15 to 20% of all cancers are caused by tobacco. But if you look globally, actually it's about 1/3 of all cancers are just caused by one product that's made by a handful of companies. So I was qualified and I did all my specialty training, and then my husband and I decided to buy a house. And we sat down with the accountant, and the accountant said to us, look, you two need to sort out your money. How much do you have in your pension plan? And in Australia, like in many countries, we have a compulsory pension system, and I knew that. I'd paid absolutely no attention to it ever, but I did know that I had a pension plan. So I had to even do some research and find out which pension plan I had. And as the accountant instructed me, I met with a representative from my pension plan, and it was a pension plan for all of the healthcare workers working at this huge hospital, the Peter MacCallum Cancer Centre, where I was now a specialist. And we met at the cafeteria at the hospital. He showed me how much money I had. We had a nice little chat. I remember having a latte and having a pleasant conversation. I shook his hand and then I walked away. The meeting had finished. And it was completely an afterthought that brought me back. And I actually sort of rushed back to the table and I said, oh, by the way, was I meant to tell you what to do with that money? And he said, no. He completely reassured me. He said, no, it's all taken care of. You're in the default option, or the default option. And I sort of thought, oh, option. And I said, look, does that mean there are other options? And he looked at me and he rolled his eyes at me and he said, oh, look, there is this one special option for people who have a problem with investing in mining, alcohol or tobacco. And then there was silence. And I said, did you just say tobacco? And he said, yes. And I said, so are you telling me I'm currently investing in tobacco? And he said, oh yes, everybody is. And that was 2010. In fact, it was March of 2010. So it was exactly 11 years ago. And it was a moment that ended up changing my life, because I just, immediately got a knot in my stomach, and I thought, how can I go to work every single day bearing witness to the true impact of tobacco and knowing full well the impact, not just on the person, but on the family, on the community? How can I completely understand that? And yet at the very same time, my own money is investing in the companies that make the products that are killing my own patients. And I just, I really haven't slept very well for the past 11 years, because I just think that is just something that needs to be fixed. And, and I'm sure people in this audience would really appreciate that when you step back, the global health sector really is doing everything it can when it comes to tobacco. We have researchers trying to research better treatments, and we have public health experts looking at better prevention and ways to protect people from the ills of tobacco. But that's not enough. That is not enough. Last year, 2020, 8 million people died. So our health efforts are great, but it's not enough. Governments really are doing virtually everything they can up against a very tough industry. So more than 180 governments have signed up and become parties to the WHO Framework Convention on Tobacco Control, and they're gradually chipping away at implementing tougher and tougher tobacco control regulation. So governments are doing lots and lots, but also it's not enough. And then I think of parents, and if you can hear people in the background, that's because my children won't go to bed, and so I don't know if you can hear them. They're shouting, unfortunately, right at the moment, so I do apologise. But I know firsthand parents are doing everything they can to protect their children from tobacco, and communities and schools. And so if you think you've got all of these different segments of society that are all lined up, standing shoulder to shoulder, trying to prevent this terrible problem of tobacco, the problem is the finance sector has by and large been left out of that conversation. And without really meaning to, just the system of the finance sector means that big pension plans all across the world routinely invest some of our money in tobacco companies. Banks lend tobacco companies money, and insurers insure them just like they were any other company. And that action of the finance sector is really undermining everything that everyone else is doing. And this problem is just too big to be solved when you've got such a crucial, influential sector, the finance sector, not being part of the solution. So I really simply started by trying to learn more. So for example, the very first thing I asked was, well, can you tell me which shares do I have? Which companies do I own a little bit of? Because, if you invest in a company, you actually own part of that company, and you want that company to grow and succeed and thrive, and you want that company to find new customers, and you want that company to sell more of its products. And so, I couldn't think of anything I wanted less. So I thought, well, I better find out, which companies do I own? And I'll never forget when this pension plan representative, he rang me back 2 weeks later, and I was on a ward round, and I just scribbled it down on a note of paper, which I still have. And he said, here are your holdings, and these holdings are in the international shares portion of your portfolio. And for people under 50, I was under 50, it's about 50% of your portfolio in Australia is in international shares. That's a little bit different around the world, but it's a big chunk of your portfolio. And he said, your number one holding in your international shares portion of your portfolio is British American Tobacco. Number 2 is Imperial Tobacco. Number 4 is Philip Morris. And number 5 is the Swedish Match Company. So 4 of the top 5 holdings for a cancer doctor at the biggest cancer in the Southern Hemisphere were tobacco companies, which of course just makes absolutely no sense. So I had to learn a lot. I had to learn a lot about finance, about the systems of finance, the regulatory environment, the rules, the structures, the language. I had to really learn how to try to bridge this gap between finance and health. And most of all, I had to learn how to tell my patients' stories to try to create change, because most of my patients weren't there anymore. Most of them have passed on, but I have their stories. And I think that, in the health sector, that's one thing we really do have that's very powerful. We have patient stories, and telling those stories can really help create, a lot of power behind our words. And so I really had to learn that. And so I was very pleased it was 2 years later, but I was very pleased when 2 years later, my pension plan, which is one of the biggest pension plans in Australia, it's in the top 30 in the world, it's a very big pension plan, they decided to go tobacco free. It was very tough at first. The conversations were really tough, and a lot of people thought, you know, it was a ridiculous suggestion that they would exclude something from their investments, because that really hadn't been done except by very religious institutions or by some boutique institutions in finance that were specifically ethical and only had a tiny portion of the market. Mainstream finance really was not at all comfortable with the concept of exclusions back in 2010. And so I was very pleased when the first big mainstream pension plan, my pension plan, went tobacco free. They did that in 2010, and sorry, in 2012, so it took 2 years. And this started a ripple effect because they felt great about doing it. They thought they were on the right side of history. It made sense. They got great publicity. The hospital was happy. And then there was this ripple effect. So then I started working all across the Australian finance sector, specifically with the pension plans first, but then with some other financial institutions. And so if you just bring up the next slide, Gail. So this is one of my favourite slides, which is from it's just 2.5 years ago. And this is a slide that shows the CEOs and the chairs of all of the Australian pension plans that are tobacco free. And together at the time, they controlled about $1.3 trillion of Australians' money. So all that money is tobacco free. Now, there's a couple of reasons I absolutely love this photo. One is that these people turned up. This was actually 7 o'clock in the morning. And the truth is we photoshopped a bit because actually it wasn't a very nice day. So secretly there wasn't quite so much sunshine there, but they all came, all these super VIPs came at 7 o'clock in the morning for this photo shoot because they felt proud that they were on the right side of history. And at Tobacco Free Portfolios, the NGO that I started, one of our mantras is that we name and fame. So we don't name and shame, we name and fame. We work with these finance leaders to educate them and ask them to rethink and take a very strong position on tobacco. So I'm super sort of pleased that they really feel very proud about this. This is often a legacy that they're leaving and something that they're really delighted to be part of. The other reason I love this picture is that the lady in the front left there, some of you may recognise, is Her Royal Highness Princess Dina Mered of Jordan. Now, she is the mother of a cancer survivor and has really devoted her life towards cancer advocacy, and she's the immediate past president of the Union for International Cancer Control. She also happens to be our global ambassador. And I always say to somebody, if you are trying to create a global movement, I highly recommend that you get a princess on your team. It is very handy, and it has certainly been a fantastic strategy for us. So with this, we then thought, you know what, we have a great case study to share with the world. And we really, the Australian pension sector is very large for the size of the country. And so with the majority of our country tobacco free and our pension sector doing very well and getting great returns, we started to explore how this conversation will go all across the world. And I will now introduce you to Gail to hand over for the rest of the talk to talk about how we went about constructing that argument to urge financial institutions in all corners of the globe to consider going tobacco free. And just by background, so Gail's an economist by background. She's worked for 10 years at the UN Development Program in New York, and she led the development of the world's first tobacco social impact bond, which is a fancy financial product that aims to do its bit for global tobacco control by helping farmers find a different crop that can be successful and replace tobacco. So it's a pleasure to introduce Gail, who is now leading our work in the UK and Europe.
Oh, thank you, Bronwyn, for such a fantastic introduction to the work of tobacco-free portfolios. And it's a real privilege to join the team, you know, just over a month ago, actually. And, you know, really pleased to join you all today. Thanks for the invitation to discuss this important topic. I'm now based in Scotland, and I found the figures, you know, shared earlier by Christine on the numbers of pregnant women smoking in some parts of Scotland really quite shocking. So, you know, it is a really critical issue. So my background, I mean, as Bronwyn said, I'm an economist and senior advisor on sustainable finance and international development by background. I worked for the UN based in New York for 10 years prior to joining tobacco-free portfolios. And we saw earlier the photograph of Bronwyn with all that sophisticated machinery dealing with, you know, the really tragic consequences of tobacco consumption. But my own story begins, you know, if we rewind back to the very start of the tobacco production process, my story starts in a very, very different environment. So there is me in a low-income smallholder tobacco farmer's field in rural Zambia a couple of years ago, when I was leading a small team looking to see if we could develop the world's first tobacco control social impact bond. So looking at ways we could work with the financial sector, ways we could work with the international aid donor community and farming communities, and ways that we could leverage new resources to support low-income rural farmers in Zambia transition to more profitable, more sustainable livelihoods. And I can say from my own experience that over 90% of them really want to do that. And so this is us in a school classroom in Zambia, where we were meeting with farmers and their families to discuss what they needed and how the work could move forward. But, you know, why is all this work needed in the first place? I mean, I probably don't need to tell this audience, but, you know, I'll start with the really sobering and shocking statistic that, you know, tobacco is on track to kill 1 billion people this century. So Bronwyn mentioned 8 million this year alone. It's on track to kill over 1 billion this century. And as Bronwyn said, that is caused by just a handful of companies. But of course, there are many other reasons why we don't like tobacco. Tobacco farming is associated with a whole slew of other problems. So we know it's carried out by children in 16 countries around the world, and some of them are the world's poorest countries, like Zambia, in which I worked. And I can say from my own experience that tobacco farming in no way represents a route out of poverty or deprivation for the communities that farm it, and limits, you know, children's and families' life chances and opportunities. So this is another photograph from my time in Zambia a couple of years ago, and I call this photograph the face of tobacco farming in Zambia. And they say that a photograph says 1,000 words. And I think one of the most striking things for me to see there was how farmers are not compensated for the significant additional labor and environmental costs associated with tobacco farming. So this gentleman, for example, had to build his own tobacco curing shed, and then he has to go out into the forest to source wood for the fires that he needs to burn in order to cure tobacco leaves, which contributes to deforestation and environmental degradation in turn. So there are significant other harms from an environmental point of view that are associated with tobacco. And another of these is that cigarette filters are the #1 plastic destroying our oceans. So cigarette butts are the world's #1 littered item worldwide, and many of them find their ways onto our beaches, into our oceans, into other waterways. And cigarette filters contain plastic, and that plastic breaks down into microplastics, polluting our precious marine ecosystems. And of course, we're all increasingly concerned about that these days. So we know that there are many challenging sectors, and you know, Bronwyn mentioned a couple of those in her remarks earlier on. So there are some of the well-known ones, for example, you know, related to the arms production or gambling. I know from my own work in international development that there are also many problems associated, for example, with palm oil or with beef. So why is tobacco so different? So, you know, there are many tools that you can use for change. But we also say that many of these tools that you can use for change are not appropriate for tobacco. And why is that? So one tool is engagement. You can engage with companies and try to get them to improve their environmental performance or improve their governance. But actually, the United Nations that I worked for recommends a policy of non-engagement with tobacco companies, because that engagement is a conflict between there is a fundamental conflict between tobacco and the human right to life and the human right to health. And in any case, why do you engage with a company? You might engage with them because you want them to sell more of a product or improve the quality of that product. And that is not the case with tobacco. Perhaps you could invest in companies that represent only the best of sector, so those with the best performance. But you know, that only ranks tobacco companies against each other, which again wouldn't be appropriate, because the best outcome, the only outcome we want to see, is that they cease production of what they're doing. ESG, you know, we've seen a huge rise. That's environmental, social and governance. We can encourage them to improve their performance on the environment, social, governance factors. We've seen a huge interest in you know, increasing investment in sustainable financing, responsible financing, green financing, and all of that. But our concern is that many of those products that are labeled sustainable or environmentally friendly or you know, SDG compliant don't explicitly contain tobacco exclusions. And you know, there are so many problems associated with tobacco. And in any case, if you, just because you score well perhaps on governance, and you score well on a female, you know, board representation, you know, which is great, that doesn't mean, you know, you're a good company. At the end of the day, what are the products and services that your company is making? You know, impact investing for those, or thematic investing for those of you that are familiar with these terms, that's investing for a positive social and environmental impact in addition to a financial return. So obviously those, again, wouldn't apply to tobacco companies. So those are the reasons why we recommend, you know, that exclusions of tobacco companies are the only way forward. So what are some of the questions that are used to justify those exclusions? I mean, very simply, we ask people to think about whether the product that a company is making is safe. And I think that that's a very reasonable question to ask. And so when you ask that of tobacco companies, are you making a product that is safe? The clear answer to that is no. There is no safe recommended level of tobacco consumption. The number of cigarettes that a human can safely consume is 0. And secondly, is the problem of a scale where it is internationally recognized that something needs to be done about the problem? And the answer is yes in this case. So several years ago, there was a UN framework convention on tobacco control agreed at the international level. Over 180 countries have signed up to this tobacco control convention, representing over 90% of the global population, that commits governments worldwide to do something about tobacco control. And finally, the tools that you would usually use, like engagement with tobacco, engagement with a company to improve performance over a variety of metrics or standards, they don't apply to tobacco companies, because the only outcome we would want to see, the only acceptable outcome from a public health perspective, is that tobacco companies cease what they are doing and end what they're doing. So what we're doing is aligned with, you know, so many UN initiatives worldwide. The most well known are the UN Sustainable Development Goals. I worked on these in the run up to 2015 when they were agreed. They've created a lot of international interest and enthusiasm. They've really captured global attention. And tobacco actually undermines 14 of the 17 Sustainable Development Goals. We've seen also over recent years a slew of UN-sponsored initiatives on responsible and ethical finance, designed to precisely move capital and investment away from what we don't want it to do and try to move it towards what we do want it to do, which is to support achievement of the Sustainable Development Goals around the world, and in particular, those countries that are furthest behind. If you're an investor, you know, why wouldn't you want to invest in tobacco? If you're an investor, what might be some of the considerations that you would take into consideration when you're investing your money? So we say that, you know, investors should take into consideration the regulatory risk associated with investments in tobacco companies, because there's a UN treaty signed by over 180 countries worldwide committed to enhancing tobacco control regulation. Regulation will only tighten in the future, and that's a positive thing. Litigation risk. The business model of tobacco companies is increasingly being questioned now. As we've seen from the examples that I've given, we have an industry that has externalized its costs to society, it's externalized its costs to the environment, while it's internalized all the profits. And none of these risks are reflected on the balance sheets of tobacco companies. And people are increasingly questioning whether that's right. Supply chain risk, of course, we've seen that tobacco farming is associated with a whole range of problems related to low-income communities, child labour abuses, vulnerable communities worldwide. And many investors won't want to be associated with that. And the environmental risks that I've already touched on. And finally, the reputational risk. You know, companies and investors increasingly are concerned about their reputation, and many do want to be seen to be doing good things these days. And that's positive, and also recognize that it makes good business sense to do so. But if you do care about the money, and you're not too fussed about all of the things that I've talked about, you'll actually see that you know, the data speaks for itself. Do you actually need to invest in tobacco to generate strong and stable returns? for your investment portfolios? And the answer is no. You know, we often get asked whether tobacco is a solid investment. And this graph here shows that tobacco companies are actually not performing that well. So the blue line there is the share price of the S&P 500 over the last 10 years rising, and then the orange line is the S&P tobacco share price over the last 10 years, and you'll see over the last few years in particular that price has declined by around 40 to 50%. And we say that the factors that are contributing to that declining share price are still there and are arguably intensifying. So, you know, we are sounding we're ringing the bell, and we're bringing more champions on board, and we're increasingly seeing many financial sector actors move away from tobacco. We're increasingly seeing a convergence between doing what is right and ethical and sustainable, and reaping the financial rewards. And I mean, Bronwyn can speak more about our flagship initiative, the Tobacco Free Finance Pledge, which, because I was working at the UN at the time, I was privileged to attend in New York, even though I'm not in the photograph, unfortunately. But in 2018, Tobacco Free Portfolios launched its flagship initiative, the Tobacco Free Finance Pledge, in partnership with the UN Environment Programme, the UN Principles for Responsible Investment, the French and Australian governments, AXA, BNP Paribas, some great supporters there, to try to encourage as many financial sector actors as possible to commit to tobacco-free finance over the coming years, and to champion that action amongst their peers. And we're now very happy to report that we have over 161 signatories worldwide to the Tobacco Free Finance Pledge, representing over $11 trillion in assets under management that are now tobacco free. We're aiming for 20 trillion, sorry, over the course of the next year. And being based in Scotland and the UK hosting of the next UN Climate Change Conference in November this year, we think is a big opportunity for us to raise awareness of the many environmental harms associated with tobacco, in addition to its shocking public health harms. And you know, many financial sector actors are keen to advertise their green credentials in the run-up to COP26. So how can we capitalize on that moment and really get more champions on board? Momentum is definitely going in the right direction, and we definitely encourage all of you to join us on this journey. So perhaps I'll hand back to Bronwyn here, and I very much look forward to your discussion, to the discussion and your questions. Thanks.
Thank you so much, Gail. If you just advance a couple of slides, I'm very pleased to say we now need 3 slides to fit all of our logos on. So this is, you know, this is a work in progress, and we can't wait for there to be more and more in future. So if we just go through those, and really, there we go. And there's lots of room for more financial institutions. So whenever we're speaking to someone, I always say the great news is there's a nice little spot just there for your company's logo when you're ready to make this decision yourselves. And today, because obviously I'm speaking